Hello guys, this is Ojas from Medico Awesome, and as promised, I am coming with the practical aspect of the central nervous system. And today we are going to talk about the higher mental function. But before that, I want to tell you that there are some part which you also need to cover on your own, or I will be posting subsequent topic videos or blogs about it. But few topics cannot be covered here, at least the major chunk of it will be covered. So memory, speech, and visuospatial, these are the topic which deserves your separate attention. So while doing it, I want to tell you that I will be covering the major chunk of it here. So let's get started. This is the pro forma of the video, what topics we are going to talk about here. I have combined from various books to make this, and I hope that it will be useful for you. Please do give your comments on in the comment section. Okay, so this is the pro forma. We are going to talk about 10 things here. One, consciousness; second, orientation; and from third to 10th we have mnemonic called BMI shape, which goes, it is very famous mnemonic which goes with the name of B for behavior, M for memory, I for intelligence, S for speech, H for handedness, 8 for agnosia and apraxia, P for perception, and E for emotional status. So, talking about the first part, that is consciousness. Consciousness is defined as the state of awareness of the self and environment. And if your a patient is not conscious, which is generally not the case in UG days, but if he is not, you have to study about how to approach the patient with who is in coma, or the other part of it. Usually the question are asked about the definition of the consciousness, and the other part asked is the definition of semi-consciousness, vegetative state, locked-in syndrome, akinetic mutism, and abulia, and obviously catatonia and delirium. And after this, we come to the another part, which is what is confusion. Confusion is lack of clarity and coherence. Coherence is being logical and being consistent in logic. So lack of clarity and coherence of thought, perception, understanding, or action. Now, why it is important? The first thing is because it's the first feature of cognitive impairment. Now, the most thing you must do in GCS must be done in all patient, and especially in head injury patient. A video of GCS has already been uploaded, so please go through it. The second thing which you need to uh, examine is orientation. Orientation is with respect to time, place, or person. Time asks the a patient to tell the year, season, date, day, and month. Place asks for the state, country, town, hospital, and floor in which he is admitted. Person is asked for his identity of his nearby relatives or neighbor, and for self you have to ask his name, age, address, and qualification. Now remember this is very important, that always ask in order, that is time followed by place followed by person. Now why do we do this? Because time is earliest to be lost, followed by place, and last to be lost is person. Recovery is in opposite order. That is, earliest to recover is the orientation of person, last to recover is orientation of time. Now coming to the next part, that is behavior. uh, you can ask patients relatives of if his behavior has changed or not, and observe his behavior, how he carries himself, his personal hygiene and all. Now he can be agitated, confused, or normal, but this is something which always enthralls me, that is the behavior change after the frontal lobe lesions. And internet is full of such examples. You can go through it and learn and read if you really like to know about it, how the frontal lobe lesions change the behavior of the patient, and also amygdala lesions. Now coming to the fourth part, that is intelligence. Intelligence has components which needs to be taken care of. So the first thing is abstract thinking. Now you ask him the meaning of the proverb and see if he's able to give the moral of the proverb. The second thing is reasoning. Reasoning is comparing objects and talking about the similarity and dissimilarities. And you give him one lie and one mistake and ask him to differentiate which one is the lie and which one is the mistake. And the third one is judgment. You ask patient, uh, you give him some scenario and ask his action on it. So you ask him, if the house is on fire, what will he do? Normal patient will call ambulance and at the same time will call fire brigade. And the second scenario which you can give is stamped envelope on road. So what will you do? So the normal patient will obviously give it to post office. And the next one is attention. Your attention and calculation goes in hand in hand. You ask him to subtract 7 from 100 till 7 digits. This is also called till 7 consecutive numbers come. So this is also called a digit span. Okay, and the calculation is covered in attention as well. Now memory is something which needs to be given special attention because it also includes the MMSE scale, that is mini mental status examination scale. But I will be covering a short part of it here, which includes components. Components includes the reception, registration, retention, and recall. Now memory is of three types, that is short term memory or immediate recall or rot memory, and recent memory and past memory. Past memory is long term memory or remote memory. Now coming here to the short term memory. Short term memory is memory which lasts for 30 seconds and it is tested by digit span test, which I already talked about. So you ask patient whether the patient can repeat 7 digit forward and 5 digit backward. Give him any random numbers, 7 digits straight forward, that is 3, 18, 21, 74 and all, and 5 digits backward, which goes 100, 89, 78, 64, 59. And this is the one way you can test the short term memory. The second test is, for short term, is you can ask the patient to spell any word backwards, like India. It is used for testing the working memory, good test for working memory. And the third thing in short term memory you can do is give him a telephone number and ask the number after 30 seconds or so. And then we have the recent memory. Recent memory is the events occurring within minutes, weeks, months, and it is also an index for severity of the organic brain disease, which is usually tested by asking the morning news that he has read in the newspaper or seen in television. Or you can ask him the name of 3 different objects and ask it after 3 or 5 minutes. Ask him about the name of the visitor whom he met last evening or night. And the past memory is events occurring years back. So you ask patient about some important events in his life, that is date of birth, date of marriage, etc. Or you ask him the date of Independence Day of India, or ask him the name of the prime minister. And remember one thing, that uh, in Wernicke-Korsakoff syndrome, the recent memory is lost with intact past memory, whereas in the past memory is affected in dementia. Dementia is separate topic which needs your special attention. So I will highly recommend you to go through your textbook and read dementia again, because it is very frequently asked in your Viva questions. And we have here speech. Again, speech is something which requires the special attention. Like memory, it also has components, and there are 3 components of speech, which includes fluency. Fluency requires Broca's area plus motor association area. Comprehension includes Wernicke's area and sensory association area. The third one is repetition. Repetition requires both your Broca's and Wernicke's area plus arcuate fascicula, which connect two area. Now remember one thing: speech has 7 aphasia types, which are normally asked. So you need to know all 7 of them, but the least you can do is you can know 3 of them. That is global aphasia, sensory aphasia, and motor aphasia. So speech, I will be making one more blog about it, and hopefully and then I will add to the description box whenever it is ready. Coming to the next topic, that is handedness. Handedness is preference to use the hand of a particular side for complicated skillful and motor function. Now you can simply ask him which hand he used mostly, or you can ask him to which hand he used for combing his hair or buttoning the shirt, or you can ask him to you can simply ask him to fold his hand and see which hand comes anteriorly or superiorly. That will be his handedness. So why handedness is important? Because in 90% of the right hand people, 95% have Broca's area on the left side, while 5% have on the right side. And in the 10% of the left-handed people, of them 50% have Broca's area on the right side, while 50% have on left side. And handedness of an individual is fixed at around 3 or 4 years. Now coming to the visuospatial function. Visuospatial function include 2 things. Please listen carefully. Which includes agnosia or apraxia. Agnosia is defined as the failure to recognize known objects in the presence of intact sensory, visual, and auditory pathway. Now it includes tactile agnosia, visual agnosia, prosopagnosia, and anosognosia. So tactile agnosia is patient is not able to recognize object in the presence of intact sensory system, and also he should have sufficient coordination to explore the object. The second one is visual agnosia. Visual agnosia is inability to recognize what is seen with the eyes in the presence of intact visual pathway. And again, he should be able to describe the object in the with respect to its color, size, and shape. The other part is prosopagnosia. Prosopagnosia is the inability to identify a familiar face, which occurs in parieto-occipital lesion. The other one is anosognosia. It is the lack of awareness to recognize the parallelism. It is due to right parietal lobe lesion. And coming to the apraxia. Apraxia is the defect in the ability to carry out known acts in the absence of motor weakness, sensory loss, or ataxia. Now, consequently, there are types of apraxia, which is are of 4 types. One is the limb kinetic apraxia, in which the specific motor disability of one limb is seen, usually an arm, and there should be an absence of gross weakness or ataxia. The second one is ideomotor apraxia. Ideomotor apraxia is referred to the condition in which the patient is unable to carry out the motor command, and despite adequate comprehension of the command and adequate motor and sensory function to perform the command. And remember, this is the most frequent type of apraxia. And third one is ideational apraxia. This refers to the condition in which patients are apraxic because they have lost the idea, that is concept behind the still movements. And the fourth one is buccofacial apraxia, in which the condition in which the patient cannot perform learned skill movements of the mouth, lips, cheeks, throat, and tongue. So that was visual spatial function. We covered apraxia, and we also covered agnosia. Both have 4 types, and if you know more types of them, please do comment on comment section. The second one is perception. Perception is nothing but you need to know the definition of delusion, hallucination, illusion, and obsession. Delusions are the false belief which still continued despite giving the proof against it. Hallucination is false impression which is referred to the organs of special senses. Uh, so this is hallucination. Illusion is misinterpretation of the stimuli, and obsession are the current and persistent thoughts which intrude the person or patient mind. Emotional status is something which you can ask patient, or you can simply conclude yourself. There are two types here which you know: mood and affect. And you should know about it, what mood is and what affect is. And talking about it, uh, mood is the prevailing emotional state, and affect is the emotional experience evoked by a particular stimulus. So you can say that mood is what person feel and affect is what you feel about the person. So a person can be cheerful from the outside, but he can be really sad from the inside. So this is mood, and affect is what he shows to the other. So I hope it was useful. Please do give your comment and let me know if I can improve in some other way. Don't worry, I will be writing more blogs or podcasts to cover memory, speech, and visual spatial functions. And I hope it was useful to you. And do tell us how I can improve. Okay, bye bye.